Your period just showed up and it's not the color you expected. Maybe it's brown, maybe it's almost black. Maybe it's lighter than usual, kind of pink or weirdly dark red. And now you're standing there wondering, is that normal? Should I be worried? By the end of this video, you're going to know exactly what each color means, when it's completely fine, and when it's worth getting checked out. If this is something you've ever wondered about, drop a comment below right now and tell me what brought you here today, because trust me, you are not alone. Save this video too, because you'll want to come back to it. My name is Gig Nurse, and I'm a health educator. And today we're talking about one of those things that not enough people explain clearly: what your period color is actually telling you about your body. Let's get into it. So first, here's the thing a lot of people don't know. What comes out during your period isn't just blood. It's actually a mix of blood, uterine lining tissue, cervical mucus, and vaginal secretions. All of that together is what gives your period its color and texture, and it can change not just from cycle to cycle, but literally day to day within the same period. That's completely normal. The main reason color shifts happen comes down to two things: how fast the flow is moving, and something called oxidation. When blood exits your body quickly, it stays bright red because it hasn't had time to react with the oxygen in the air. But when it slows down and pools in the uterus before coming out, it oxidizes, basically the same reason that iron rusts when it's exposed to air. The longer it sits, the darker it gets. Keep that in mind as we walk through each color, because it explains a lot. Let's start with bright red, because this is the one most people think of when they think period blood. Bright red means fresh blood moving at a steady pace. It's typically what you'll see on your heaviest days, usually in the first couple of days of your cycle, when your uterus is contracting most actively to push the lining out. Those contractions, by the way, are also why you feel cramps. Your uterus is literally squeezing. Bright red throughout your entire period is also normal for a lot of people. Some people just have faster flow. Nothing alarming about that on its own. Now, if you notice bright red spotting between periods, not at the start of your cycle, but randomly in the middle, that's something to bring up with your doctor. It could be nothing like ovulation spotting, but it can also sometimes point to things like polyps, hormonal shifts, or infections. It's worth a conversation, not a panic, but definitely worth mentioning. Now here's what's interesting. Dark red period blood is actually incredibly common, and one of the most confusing ones for people. Dark red, almost maroon-looking blood usually means it took a bit longer to exit your uterus. That extra time allowed oxidation to happen, darkening the color. You'll often see this at the very start of your period, especially if a bit of blood sat in the uterus overnight before your flow fully got going. You might also see it at the tail end of your period as things wind down. Both completely normal. Dark red blood at the beginning of a cycle can sometimes also just be leftover tissue from the previous cycle that didn't fully exit. Again, this is your body being efficient, not something going wrong. Okay, so brown period blood. This one surprises a lot of people and sometimes causes real worry. But brown blood is almost always just older blood. The darker and browner it is, the longer it's been sitting before it came out. Brown discharge at the very start or very end of your period is one of the most normal things your body does. Think of it this way: at the end of your period, your flow has slowed way down. The remaining blood trickles out slowly, has time to oxidize fully, and by the time it exits, it's brown. Some people also start their period this way if a little blood sat in the uterus before the full flow kicked in. Brown spotting between periods, while it sounds alarming, is often also old blood from the previous cycle or from ovulation. That said, if brown discharge comes with a strong odor, unusual cramping, or other symptoms you don't normally have, it's worth getting checked. Now let's talk about black period blood, because that word black is enough to make anyone nervous. But here's the reality. Black blood is typically just very old, very oxidized blood. Same principle as brown, just further along the spectrum. It's most common at the very beginning or very end of a period. Occasionally, you'll see it if your flow has been particularly slow and blood has had a long time to oxidize before leaving the body. For most people, a little black blood here or there, especially at the beginning or end of a cycle, is not a sign that something is wrong. If you're seeing a lot of black blood regularly, or it's accompanied by pain, a bad odor, or changes in your cycle timing, then yes, loop in your doctor. Let's switch gears to pink period blood, because this one is interesting. Pink usually means your menstrual blood is being diluted, mixed with cervical fluid or discharge, which lightens the color. It's common at the very start of a period when flow is still light, or at the very end. Pink spotting around ovulation, roughly the middle of your cycle, is also something many people experience and is generally nothing to worry about. Here's something worth knowing. Pink, lighter than usual blood can sometimes be associated with lower estrogen levels. Estrogen helps build up the uterine lining, and if levels are on the lower side, whether from intense exercise, stress, being underweight, or the beginning of perimenopause, the lining may be thinner and the resulting flow lighter and pinker. If your period has consistently become much lighter and pinker than it used to be, and especially if it's shorter too, mention it to your doctor. It's not necessarily a problem, but it's useful information. Now here's where the color chart takes a turn. Orange period blood sits in a gray zone. Sometimes it's completely normal. It can happen when blood mixes with cervical fluid, creating that orange tint. But orange that comes with a strong or unusual odor, itching, burning, or general discomfort can be a sign of a vaginal infection like bacterial vaginosis or a sexually transmitted infection. The key is context. Orange on its own with no other symptoms, probably nothing. Orange with other symptoms, get checked. And then there are the colors that are almost always assigned to make an appointment: gray and green. Gray discharge, especially if it has a fishy odor, is a classic sign of bacterial vaginosis, which is a common and treatable bacterial imbalance in the vagina. It's nothing to be embarrassed about. It's not a reflection of hygiene. And it's very fixable with the right treatment. Green period blood or discharge is also not normal and often indicates an infection, potentially a sexually transmitted one like trichomoniasis. Both gray and green are your body waving a flag saying, "Hey, something's off in here, please get it checked." These are easy to treat, but they don't typically go away on their own. Before we wrap up, let's talk about clots, because they're a color-adjacent concern that comes up a lot. Small clots, darker, jelly-like bits, are completely normal on heavy flow days. When your flow is heavy, your body's natural anticoagulants can't break everything down fast enough, so some blood clots before it exits. Clots smaller than roughly the size of a coin are generally nothing to worry about. If you're regularly passing clots larger than that, soaking through pads or tampons very quickly, or your heavy days are seriously impacting your daily life, that's worth discussing with a doctor. It can sometimes indicate conditions like fibroids, endometriosis, or adenomyosis. One more thing I want to address before we close out, because it comes up a lot online: the idea that period color can tell you about your iron levels. You may have seen claims that pink blood means you're iron deficient. There's actually no solid medical research backing that up. Iron deficiency doesn't directly change the color of your blood. The colors we've talked about today are driven by oxidation, flow speed, and what's mixing with the blood, not by iron levels. If you're concerned about iron or anemia, particularly if you feel very fatigued around your period, that's worth a blood test. But period color alone isn't a reliable indicator. So here's the quick recap. Bright red means fresh, fast-moving flow, totally normal. Dark red and brown mean older, oxidized blood, also normal, especially at the start or end of your cycle. Black is heavily oxidized, old blood, usually fine in small amounts. Pink can mean light flow or low estrogen. Orange is a watch and see, context matters. Gray and green are your cues to see a doctor. And clots smaller than a coin on heavy days are normal. Larger ones repeatedly are worth mentioning to your provider. Your cycle is one of the most informative windows into your overall health. Paying attention to it isn't something to be embarrassed about. It's genuinely useful information. And now you have the knowledge to actually read what it's telling you. If this video helped you make sense of something you've been wondering about, I'd love it if you subscribed. I'm here to answer exactly these kinds of questions, because everyone deserves to understand their own body. Thanks for watching, and I'll see you in the next video.